Coming to Corynebacteria diphtheria. Okay, Corynebacteria diphtheria. So this is the respiratory unit in which we are trying to cover the topic diphtheria. So Corynebacterium diphtheria is the causative agent of diphtheria. Now what does that do? They primarily infect the throat and they produce diphtheria toxin. Okay, after that, which this diphtheria toxin is responsible for exudative pharyngitis and membranous tonsillitis. Now, coming to the history of this Corynebacteria diphtheria, first the diphtheria was recognized by Pierre Bretonnier, that is leathery pseudomembrane formation over the tonsil. Leathery pseudomembrane formation over the tonsil. And the Corynebacterium diphtheria, the first was it was recognized by Kleb and cultivated by Loefflers. So the name came Kleb-Loefflers bacillus. Okay, so this is the history, that leathery pseudomembrane formation over the tonsil, and that is due to the term came from diphtheria, and Corynebacteria diphtheria, that is came from the Klebs-Loefflers bacillus. Next is morphology. Okay, coming to morphology. Corynebacterium diphtheria is a gram-positive bacilli. Okay, these are non-capsulated, non-sporing and non-motile bacilli. Gram-positive, but they tend to decolorize easily. Okay. Now another point is they frequently show club-shaped swelling. They have several species. Now the name comes as called as diphtheroids. Out of the different species, the Corynebacterium diphtheria is pathogenic and others are commensals to the throat and skin in humans. Okay, so what are the main points here? This is gram-positive, then non-capsulated, non-sporing, non-motile, club-shaped swelling, and they are termed as diphtheroids, and pathogenic one is the diphtheria and the other are commensals. Then, what are the two characteristic features of this Corynebacterium diphtheria? Now that is related to its arrangement. Okay, one is cuneiform or Chinese letter arrangement. Another is metachromatic granules. Cuneiform or Chinese letter means they appear as V or L shaped. Okay, now that is the snapping type of division. Why do we call this as V or L and snapping type of division? Because the bacterial cells, they divide, and the daughter cell, they tend to be in the acute angle to each other. Okay, so they appear as a V or an L appearance. Okay, that's what we call as cuneiform or Chinese letter arrangement. Next comes the metachromatic granules. What does that mean? When we add Loeffler's methylene stain, now they appear as bluish granules. Okay, at the end of the pole of the bacilli. Okay, this here it will be bluish granules. Now we call it as volutin Babes-Ernst granules. Now these metachromatic granules, these are called volutin and Babes-Ernst granules, and these are the storage granules, okay, composed of polymetaphosphate. So what are these metachromatic granules? These are the storage granules which are composed of polymetaphosphate. Now these are better, we are staining it with Loeffler's methylene stain, but better stained with Albert stain and Ponder stains. Now granules well developed in the enriched media. What are the enriched media we use in this case? That is blood agar and Loeffler's serum slope. Okay, now these metachromatic granules can also be seen in Corynebacterium xerosis and Gardnerella vaginalis. So we just saw about what is Corynebacterium diphtheria, what is the disease caused by it, how the name came, now what they primarily do, and about the morphology, and then the appearance, the arrangement. Next is virulence factor. Okay, virulence factor. The primary virulence factor of this Corynebacterium diphtheria is diphtheria toxin, DT, diphtheria toxin. Now we will see the structure of this diphtheria toxin. This diphtheria toxin is a polypeptide chain which has two fragments, okay, A and B. The A one is the active fragment and B is the binding one. B binds to the host receptor and helps the entry of A into the cell. Now the fragment A that will enter the host cell. Now what will it do after entering? This fragment A, the active fragments that will undergo ADP ribosylation of elongation factor 2, that will lead to the inhibition of this elongation factor 2, that will lead to inhibition of translation step of protein synthesis. So this is the mechanism of this diphtheria toxin, and this mechanism is similar to the exotoxin A of Pseudomonas. They have the similar action as that of this diphtheria toxin. Now, what are the factors regulating the toxin production? Okay, since this is Fas coded, they will remain toxigenic as long as the Fas is present inside the bacilli. As long as this Fas will be present inside this bacilli, they will remain toxigenic. Once this Fas is not present, then this feature will be gone. So this is what we call as lysogenic conversion. Now toxin production also depends upon the iron concentration. Okay, that is 0.1 milligram per liter. Okay, so this depends upon iron concentration, and this diphtheria toxin is also produced by two other species, that is Corynebacterium ulcerans and Corynebacterium pseudotuberculosis. So what are the factors? One is Fas encoded, like they will remain toxigenic as long as the Fas is present inside the bacilli. Now these toxin also depends upon the iron concentration, and the diphtheria toxin is produced by two different species also, that is ulcerans and pseudotuberculosis. Next, toxoid. The term toxoid, what do you mean by toxoid? Toxoid is used as vaccination. Okay, toxin is, we know, toxic. This toxoid, the toxin has virulence property as well as antigenicity property, that is immunogenicity as well as antigenicity. But this toxoid, this is a form of toxin, but the virulence factor is lost and the antigenicity is retained. Okay, virulence is lost and antigenicity is retain. How do we do it? We usually heat the toxin. Okay, so the virulence factor will be lost and the antigenicity will be preserved, that we use as a toxoid as a vaccination. So how we will do it? The formation that is promoted by formalin, acidic pH and prolonged storage. Okay, three things we do for this formation. One is we use formalin, acidic pH and prolonged storage. Then the Park-William B strain, okay, Park-William B strain of the C. diphtheria, we use as source of toxin for the preparation of this vaccine. Okay, so what do we use? We use the Park-William B strain, okay, for the source of toxin for preparation of this vaccine. Another term is LF unit. What is this LF unit? This is the limit of flocculation. Okay, that is the amount of toxin which flocculate most rapidly with 1 unit of antitoxin. So what do you mean by LF? LF is the limit of flocculation, that indicates the amount of toxin which flocculate most rapidly with 1 unit of antitoxin. So this was all about the virulence factor. Next is pathogenicity. Pathogenicity, we will see that incubation period of this Corynebacterium diphtheria is 3 to 4 days. Then diphtheria is toxemia but never bacteremia. So how they cause infection? This bacilli, they are invasive. Okay, they are not invasive, but the toxin, that is the diphtheria toxin that produced by them, they will enter the bloodstream and they will cause the disease. Now the diphtheria, one is respiratory diphtheria, another one is cutaneous diphtheria. Respiratory diphtheria, this is the most common form of diphtheria that we are reading. Most affected areas are tonsil, pharynx, that is the phaseal diphtheria, then the nose and larynx. Phaseal diphtheria, what is it? This elicits an inflammatory response. Okay, this phaseal diphtheria that will elicit an inflammatory response which leads to the formation of mucosal ulcers. Okay, mucosal ulcers which are lined by grayish, leathery grayish white pseudomembranous coat. Now this pseudomembranous coat, if it is not taken care and the severe case will occur, then this will extend and obstruct the airway. That is, the airway obstruction will occur. So that will be a serious condition. Another feature is massive tonsillar swelling. Okay, massive tonsillar swelling and neck edema. So that is bull neck appearance. Okay, so two important features, one is pseudomembranous coat and the other is bull neck appearance in respiratory diphtheria. Next is cutaneous diphtheria. These are the punched out lesions, okay, ulcerative lesions with necrosis and rarely pseudomembranous. Okay, now that occurs mostly in the extremities and this is not toxin mediated, so antitoxin in the vaccine cannot prevent this. Okay, so even after taking vaccine, this cutaneous diphtheria can occur. Next is complications. So what are the complications? We have some neurological manifestations and some cardiological manifestations. Neurological manifestations, that is cranial nerve involvement, that is polyneuropathy, peripheral neuropathy, ciliary paralysis. Next is cardiological manifestation, it is myocarditis, arrhythmia and dilated cardiomyopathy. So these are the complications of this Corynebacterium diphtheria. So this is overall mind map of Corynebacterium diphtheria. On the next video we will be covering the lab diagnosis of this diphtheria, that is Corynebacterium diphtheria.